Good morning, good afternoon, good evening, everybody. Thank you for coming. Responsible artificial intelligence is an approach to developing, assessing, and deploying AI systems in a safe, trustworthy, and ethical way. It involves building AI systems according to about 6 principles of reliability and safety, privacy and security, inclusiveness, transparency, and accountability. These principles are especially important in health, where lives and livelihoods are at stake. Additionally, it's important for us to discuss this intelligent technology because with every passing day, it becomes more and more prevalent in the products and services that we use. I will now introduce the panelists. First, we have Sylvia Nabukenya, who was a project manager of the COAST project, which aimed to deliver a set of synergistic AI systems for targeted surveillance and management of COVID-19 and future pandemics in Uganda. Sylvia is also a final PhD fellow in Bioethics at Makerere University. She has a growing passion for ethics in AI in health research and recently received a grant to develop a set of guiding questions to support ethical review of AI-related research proposals in human health. She also is a member of the IRB for the School of Biomedical Research and Ethics Community. You're welcome, Sylvia. Secondly, we have Dr. Rose Nakasi, a lecturer at the College of Computing and Information Science in Makerere University in Uganda, as well as a research scientist at the Makerere University AI Lab. She is the chair for the topic group AI-based detection of malaria. Her research interests are in AI and data science, and particularly for developing improved automated tools and techniques for diagnosis and modeling of diseases in low-resourced and highly endemic countries. She's currently the project lead of Ocular, a Google-funded research initiative that uses AI to support automated microscopy screening of malaria, TB, and cancer in Uganda. She's also the lead of the DSI Malaria Project. Thank you. Third, we also have Mr. Wisdom Caesar Favor, a computer scientist and practitioner of public health science at IDI, based in Uganda. He has 16 years experience in system solutions, data management, and IT project management in the field of health information systems. Over the years, he's gained understanding of the capabilities of AI in solving patient needs, especially in low-resource settings. And this has enriched his passion for improving livelihoods of communities and patients. You're welcome, Caesar.
Thank you.
And fourth, but certainly not least, we have Dr. Nneka Mobisson, a pediatrician from Nigeria, who's also the co-founder and CEO of Mdoc, a digital health social enterprise that provides virtual self-care health coaching to people with regular and chronic health needs in sub-Saharan Africa. Before Mdoc, Dr. Mobisson was an executive director at the African Institute for Healthcare Improvement, where she now serves as faculty advisor. She has also worked with multiple organizations. She earned her bachelor's in mechanical engineering from MIT, her MPH from Emory University, Rollins School of Public Health, an MD and MBA from Yale University, and completed her pediatrics residency at the Children's Hospital of Philadelphia. Thanks for coming, Nneka. All right, so we will just get into today's discussion. Our panelists have a lot of experience and knowledge to share, so we'll just jump right in. So our first question is to our panelists is, in your view, why is this the right time for Africa to embrace AI for health? And we will start with Nneka.
Thank you. Thank you so much, Dr. Seku. It's really a pleasure to be with everyone today just to share more on our beliefs and experience around AI for health in Africa. So, I mean, look, the reality is that without question today, we have an incredible opportunity in Africa. If you kind of look at us in terms of kind of where we are in terms of the opportunity for digital transformation, as it pertains to AI, we really stand at a crossroad. We have a population of 1.4 billion folks, which is continuing to grow, of which 70% of people are under the age of 30. in addition, we see a rapid growth of mobile penetration, which is expected to reach at least 50%, right, by 2025, which kind of lays down part of the digital infrastructure necessary for the deployment of AI. And then similarly, Africa has really seen kind of this 20%, on average, increase in terms of internet availability over the last decade, right? Which expands kind of the potential user base for digital health services that harness AI. And then if you look at that and then juxtapose it with what COVID did, right? Underscoring the necessity for innovative health solutions. And marry that with the fact that we have shortages abound when we kind of look at our healthcare systems across Africa. We have less than 2.5 physicians per 10,000 people, according to WHO. We have significant shortages in terms of resources, in terms of broader infrastructure, even beyond digital infrastructure. And so AI ultimately could really help us significantly amplify the capacity, not just of our healthcare workforce in Africa, but it could also really assist us in diagnostics, in patient prevention and care and management and telemedicine services, in prediction and population health services. Really, the opportunities are, as far as I'm concerned, when it comes to health and healthcare, they're really kind of boundless. And if we look at other industries, the financial sector's success with mobile money, the agriculture sector's use of AI for crop disease prediction and climate adaptation strategies, they really kind of underscore that you can leverage AI in settings where there are limitations in terms of our resources. And so AI presents kind of that unprecedented opportunity for us to really leapfrog traditional stages of development as it pertains to health. And so, but to do this, and to do this responsibly, as you've just highlighted, there are a lot of elements that we're going to need to cultivate in terms of talent, in terms of frameworks, in terms of policy, and obviously in terms of the foundational infrastructure that will allow us to really catapult and accelerate. But for me, as a physician, as a public health physician, as an entrepreneur, as someone who's been working in the digital health space for a while, I am so excited about the endless opportunities that AI can allow us to really drive kind of transformational improvements in terms of health and healthcare for our population across the continent. I'll stop there.
Thank you, Nneka. That's you make very great points. And it's true, I agree with you very much, especially because I also come from a doctor's perspective. I see the challenges in the health system, and I see this is our chance to, correct a lot of the mistakes. So I'd like to hear now from a computer scientist. Dr. Rose, from your perspective, why is Africa ripe to embrace AI for health?
Thank you very much, Dr. Lisa. And Nneka has really set ground for this discussion, which was very interesting. And from the experiences, especially as an artificial intelligence researcher in the domain of health, that I would actually do appreciate. We've come now to the fourth industrial revolution, where artificial intelligence is disrupting different contexts and its applicability. We've been able to witness the way it has supported, especially in health, the diagnostics, the preventive medications, and personalized medicine. We've seen it work in different sectors, like in agriculture, where it's automating disease diagnosis. So if we to cope up with the fourth industrial revolution, we realize that artificial intelligence indeed has become a game changer, not only in health, but in different sectors, including even business. And so this, I would say resoundingly that, yes, this is the right time for Africa not to stay behind the uptake of artificial intelligence. We also know that Africa is one of the fastest growing market economies. So it is a very rich ground to uptake the use of artificial intelligence in most of the sectors. With the diverse data sets which are available, we believe that these can actually support the development of AI-based solutions to support the different social sectors in our context. But also we have a growing pool of technocrats. We have now computer scientists like myself, and I'm proud to say that there is a growing young generation of tech experts that are starting to appreciate the use of artificial intelligence, even in the African setting. And that gives us confidence that, Africa is AI ready, and this is the time for us to uptake it. But we shouldn't also forget that, of course, there are different impediments and challenges to uptake it at this time, given the concerns and issues that Dr. Nneka talked about. We have a very poor infrastructure to support the solutions that come out of the use of artificial intelligence. There are certain areas where there is actually no electricity, where we don't have a well-developed, internet infrastructure to support most of the uptake of these solutions. But the future is bright. We just have to continue with conversations to, to keep up the momentum, and with due time, we shall be able to catch up and participate in the digital transformation. Thank you.
Thank you, Rose. That sounds very reassuring. And it's also very good to know that, we have the capacity within ourselves to do it as Africans. That's very encouraging. Thank you. And I'd just like also to hear from Sylvia. I mean, from a medical research, maybe ethical perspective, why would you feel that Africa is ready to embrace AI for health?
Thank you, Lisa, for that. And I am happy to be on this platform because I'm a bioethicist, and I like to talk about ethical issues relating to health inequalities. And I like the fact that AI is an opportunity that tries to bridge the gap of health inequalities. Ross has also talked about the infrastructure. We know that the several reasons why that health inequalities, there could be some factors related to geographical location. Some people, it could be education levels. Sometimes it can be the economic status of an individual. And so we tend to see that AI is coming in to solve some kind of bridge the gap between the health disparities that we have. And I am happy that sometimes AI can be used as an opportunity to help policymakers to prioritize which resources can be allocated, what health problems can be very urgent to consider or look into. But also something that is very special about AI, it's an opportunity for collaboration. I am happy to say that usually when you're doing AI-related work, there are a number of multidisciplinary stakeholders are coming together to kind of give solutions to what's going on, and the contribution is very, very valid. So I feel we are ready. This is the time that we need to embrace AI, and this is the time we need to see how to support one another from different kind of perspectives, from different locations, from different needs as well. So I am happy that this is the time we feel like we need to be talking about these things. Yes, thank you, Lisa.
Thank you, Sylvia. And that's true. I think that's one of the best things about responsible AI, the responsible AI approach, is that it's not one person sitting in their office with a computer. It's such a thing that brings everybody together. And I think that's especially good for our context because we are an Ubuntu community. So we come together. This is our opportunity to come together to support one another and solve our own problems. I like that very much. So maybe Favor, you could tell us, because I know you have to do this a lot in your work. What are the challenges of developing and deploying AI for health technologies in Africa?
Oh, thank you so much, Dr. Lisa. One, the challenges range from professionalism, skills, infrastructure, and as well, acceptability from the community. As they've said, AI is disruptive. When it disrupts the status quo, the way things have been working. And there are professionals who have not been using AI, and they are not used to the new normal that AI is creating. So you'll find stiff necks from even the professions themselves. Secondly, the technology. You find that if an organization has digitized its systems, AI also requires different kind of technology. These days, they are calling it seamless. screenless, and just sensing. And if you're moving that direction where data will be collected very fast, you'll be having sensors sensing everything from your bioinformation, your demographics, your heart rates. You don't have to speak anything. We have sensors picking in that, and accurately. It's a whole new game. So it means the infrastructure must change from bottom up. That's where they've started talking about vectorized databases to increase scalability. And these are real issues. It means that the databases we are using right now must be changed. That's infrastructure. Then we are looking at still a situation whereby you are going to create something that will make certain other people lose jobs. This is a reality. Even if we try to cream it, it's real. So to accept it coming, and those who don't fear, they work themselves out of the job, but in the end, they be there to validate what is being done. So these are the challenges that we are having. Then being a machine learning practitioner does not mean you are an MLOps, machine learning operations practitioner. Developing models for artificial intelligence is just different from implementing them. Implementing them and scaling them up to benefit the masses, it's something different altogether. So these are the challenges that are there. And then GEI, there's a difference between what we learn in class and when you develop a real solution to address the community. And there's been always authoritarian kind of approach to issues, but I like this time around where it is multidisciplinary. The doctor needs me, I need the doctor. The policymaker needs me, and I need the policymaker. That I'm not breaking any law. So it is now starting to bring us together to accept, and also professionalism is needed to be at its best. So these are all challenges within deploying AIs. And most important of all, the policy and the laws. Actually, the law is taken by the horns. What I mean is, it's like the lawmakers are caught off guard. They don't understand these things. And you see that because mainly the inventors and innovators of AI are opportunists, they will exploit that before the law comes at times. Yeah, so those are all challenges.
Thanks, Favor. Those are really important wake-up calls for us. And I especially like the one where you mentioned how people are going to lose jobs. And I think that's something we need to think about, because already as a continent, we do have very high unemployment rates. So on one side, while we may be very excited about creating this new technology, what is it? Is it something that's going to leave people even further behind? I think that's something we need to think about. Sylvia, I'm just keen to understand from your perspective, what do you think the challenges of developing and deploying AI in Africa are?
Well, thank you, Lisa, for this. So, the bigger challenges that I see when it comes to developing AI range from a couple of things, especially from the ethical perspective. So we know usually we're concerned about the issues of privacy. And privacy is a very important thing to think about when you're collecting this kind of data. One, we know that usually the AI requires a lot of data. And so we need to question sometimes where the data sources, where the data sources are. So sometimes more kind of platforms, social media platforms, actually even with the research, then this data can also be collected from routinely collected data in clinics, find data for research purposes, and what is required for the AI technology.
Sorry, we're losing you a bit, Sylvia.
When they want to use this data for research, sometimes also. Lisa, is this much better, please? Oh, no.
Okay, yes, I can hear you now. Please go on.
Lisa, can you hear me now?
Yes, I can hear you.
Okay.
Yeah, please go on.
Okay. Sorry about that. I don't know why my internet is. Okay, sorry, I don't know why my internet is being funny today. So basically, we need to talk about issues around data sharing across researchers, across clinicians, across any people who are responsible in position of custodians of this data. The principal, the other issue.
Sorry, Sylvia, we're losing
The
you.
other issue that is of concern is the issue about autonomy. Okay, I think let me change location in a second.
Okay, that's all right. We'll come back to you. Nneka, maybe you could also have a go at this question. I know you have a lot of experience trying to break into markets to do this. So please share.
Yeah, no, thank you so much. And you know, just building on both kind of what Favor and Sylvia have highlighted, you know, so I think that you know, there are kind of clear challenges, infrastructural, which Favor highlighted. He also highlighted the policy piece, and I would say as a co-founder of digital health social enterprise, you know, that existed pre-COVID. You know, I always say I find it interesting that, you know, in a lot of cases it took COVID for people to finally believe that digital health could work for Africa at scale. And I say we can't have that approach when we think about AI for health in Africa. But just knowing kind of what the infrastructural challenges, the policy challenges, the system level challenges, they are still very much the same, right? If you kind of think about digital health broadly and you think about AI. But so for myself as a co-founder of a startup, talent is a big one, right? I'll be frank, you know, we cannot keep up with, I will say, the hemorrhaging that is being that is occurring you know, in many places of the continent, including Nigeria. You know, it's not just tech talent, it's not just ML talent, it's clinical talent as well. I've highlighted, you know, a lot of times that we've lost 30 to 40% of our workforce to the West. Right, we can't compete if we're generating revenue in terms of naira as an example, or you know, currencies that are severely undervalued, and then we have cost bases where we have to you know, pay for, you know, data warehousing as an example, you know, with dollars. How do we really create financially sustainable, scalable models that you know, essentially leverage kind of the power of AI in actually accelerating scale and in reaching you know, low income populations. So without a question, kind of those infrastructural elements are critical. And how can policies be mindful of, you know, startup entrepreneurs like myself that are really trying to create these scalable models that prioritize impact for the lowest income populations, you know, on our continent. In addition, and help us kind of, you know, also rethink talent on our continent, right? How can we do better in terms of increasing the supply of clinicians that understand AI, of the kind of ecosystem level workforce talent that you need in terms of being able to build AI-enabled systems. That's a challenge. Even if you kind of look at how at Mdoc, how we've even worked together. I mean, as part of Hash, I've talked about this a fair bit, but it's been very interesting for me to see kind of like breakdown sometimes in between our clinician group versus our ML team, right? Because of language differentials, right? In terms just from clinicians not having enough capacity in terms of being able to understand ML yet. So we've had to invest in a lot of training. So how can we do more in terms of capacitating our health workforce, as an example, in terms of so that they're more digitally enabled and digitally savvy and actually be able to speak and it will enhance kind of collaboration with ML experts. That's a critical piece as well. And then also kind of if you think about other areas around research and development, right? I always say to our team, at the end of the day, Africa only today contributes 1% to overall research, overall global research capacity. And a lot of this work requires research. That's what we're doing as part of HASH. That's what we're doing much more broadly. And we've had to really rely on networks such as HASH and beyond to really, and outside of Africa, to be very frank, to really have that supportive research capacity and infrastructure to guide us as we've tried to be so intentional around creating, empathetic, trustworthy, safe, accurate, and contextually relevant models in our settings. So those for us have been kind of critical barriers that have been a big challenge, but I think definitely kind of relying on the network, and as I think Sylvia highlighted, kind of this cross collaboration, we've been able to really rely on that support to help propel us forward. We're just really looking for more investment in terms of that ecosystem building, and also, quite frankly, in terms of financing. This does require a significant amount of financing, and so of the ecosystem to really kind of drive and catapult the change that we need across the continent. I'll stop there.
Thank you, Nneka. You make very great points. And I think I'd like to hear also from an academic someone who's working within the research environment that you kind of touched on, Nneka. Rose, what are the challenges that you experience from your vantage point?
Thank you very much for that. And I think most of the challenges have been highlighted, but from the developer experience, some of the bigger challenges is that when you talk about artificial intelligence, the biggest issue that comes is that AI is usually data-driven, and the lack of, enough, but not only just enough, but quality data sets to drive the robust artificial intelligence modeling and solutions is quite lacking in our ecosystem. And that is usually mainly because we don't have standards against the data sets that we collect. There are data sets that are seated in silo repositories, and even accessing them is quite very hard, not forgetting the environments under which those different data sets are curated. So that, on a developer perspective, is one of the hindrances and challenges that come with development of the AI-based solutions. We shouldn't also forget the environment. With environment, I mean, there are also different changes, technological changes that actually do happen. For example, in my perspective, I use a mobile smartphone to be part of the equipment for data curation, but as well as model deployment. But usually these are technologies that keep on changing, and that technological change usually, impends when new models come in, when new developmental environments to come in. On the side of a challenge for technological development becomes a very big hindrance. For me, that has been working on development of artificial intelligence in the health sector. And one experience that I will share was a conference that we had in 2016 while we were having a conversation in Los Angeles. And this was a conversation where we had artificial intelligence experts, and on the other side, medical practitioners on the sides. So for them to be able to appreciate the black box that usually happens with artificial intelligence, that to be able to, align that with the medical standards that they are used to or they have known in school, was one of the hitting first impediments to do appreciate the use of artificial intelligence. But I'm glad that with conversations that have kept on going on over and over again, you see that we can be in one room and get to a sitting table and appreciate the capabilities that artificial intelligence are bringing in the domain of health. The other bigger challenge that I've come to witness is that mostly when we're developing AI solutions and we want to deploy them, and I think most of the speakers have talked about ethical concerns and all that, but the idea is there has been so many initiatives that have been going on to develop ethical frameworks or data governance infrastructures, or to deal with inequalities and biases that come with AI. But the thing is, do we have a guiding document, either from the WHO or from the EU? Is there a concise document? And right now, we're just finishing up a DSI in Africa conference where we're talking about data science uptake in health. But one of the major things that comes out clearly is that which is the most formidable ethical framework to rely on, so that guides the development of the solutions that come out of AI. And if that question is ably answered, then we should go a long way in deploying some of the solutions that come from artificial intelligence. The other concern is that actually we have seen a very big conversation around large language models, and especially when it gets to health, and the implication that those new technologies are having is that we have had concerns of inequality. It actually putting across more of the inequalities and bringing out so many biases that are coming in with these new technologies. So if it amplifies that rather than reduce it, then there is a very big concern. And what we need to think about is, can we be able to develop artificial intelligence solutions that built on trust, so that people gain confidence in adopting to them, but as well as deploying them in the different health units. With that, if we can be able to achieve some of those, then we know that we are on the right track to having AI clearly deployable in most of the health units. Thank you.
Thank you. Thank you, Rose. You make very good points. And indeed, we should never underestimate the value of the conversations that we have. A lot comes to light, and a lot of solutions are developed through that. And Rose, I'll just stay with you and ask you, how does the diversity of our ethnicity and culture here in Africa impact how you develop AI, and how AI is taken up in our context? And maybe you could share an experience of where you have done something to factor this into your AI development, or you've seen someone else doing that.
Oh, thank you very much. Cultural diversity, especially in our context, is not only around artificial intelligence, but even science in its own sense, where we've seen one gender being biased against doing a certain, a certain domain. For example, artificial intelligence is a science. And if you look at the statistics of women who are involved in the uptake of science or in the uptake of artificial intelligence, you'll be amazed. And this not only actually is amplified in the way of applicability, but also in some of the models that we develop, you realize that there are some amplifications of bias that comes with gender inequalities, and they are biased around gender. For my own case, there was a time I was having a conversation with a Mdoc, and one of the conversations while I was having, while we were kind of putting out our work out to them, was that who developed these models? Was it developed by a woman, or was it developed by a man? So even at that rare point, when you're just looking at the development and the bias that is in the community and in our context, that sometimes certain domains are actually just for a given gender, is something that we need to take serious and feel concerned about, that we need actually to engage more of the females to have confidence that, these are domains that they can also take up, and they can contribute to the science that comes with the use of artificial intelligence for the social good. In the models that we develop, sometimes you hear more commonly that they have, personally in my work, that has not come out, because the models that we do develop are both for male and female, but there are gender biases that come with different models that people develop. And as we're thinking about development of these models, we need to be cautious about the bias and take into consideration how those kinds of biases could actually amplify a social divide in the different applications that we develop. Yeah, I think that's what I can say about that.
Thank you, Rose, and thank you for being an ambassador for women in science. I'll just like to hear from Sylvia. I think we have her back on now. Sylvia, I'm sure this is your bread and butter. How does our diversity impact of ethnicity and culture impact our uptake of AI?
That's very interesting for the diversity of ethnicity and culture. So basically, show like how certain cultures or certain places actually embrace technologies. Now, AI is one of the technologies that is sprouting up in our setting, and how well can we embrace it given the various cultures that are in place? For example, you know, in most of African societies, uptake of technology is not very good, even when it gets to the educated. You know, sometimes systems come in place and even professors are supposed to do some reviews online, but they still struggle and they want to still do the paper-based kind of thing. And here comes the AI, which is actually trying to kind of modify the traditional ways of doing things. People are used to have a face-to-face discussion with a doctor, with a nurse, with a healthcare provider. And here comes some time when you're coming up with AI, there's a chatbot trying to tell someone that if they're asking questions regarding why they need to get services and there is a machine, someone on the other end that they can't see, it's actually some robot or machine or something trying to give them answers. And people feel like sometimes they may not be able to willingly trust the answers that come through because they are stuck and they feel like they need to have a person to talk to, a physical person. And so this is the time when we kind of call for public engagement, and how to make meaningful public engagement is it's a very key thing, especially if we want to build trust, as well as if AI developers need to be very, very transparent so that we reduce the debates of whether AI technology is designed to meet our problems or it is actually designed to kind of keep us away from the usual traditional ways of how we used to live. And so it's important that actually one of the things that we need to think about here is, first of all, define context-specific health needs and actually keep asking questions. What kind of appropriate AI technology can we take on that is actually feasible, accessible, and inclusive for all the members around in that particular community, so that we can actually promote health protection and promotion, and actually make sure that we are inclusive enough for everyone to embrace it. Because, you know, in communities, it's easy for someone, or myths and misconceptions we have around, it is easy that someone can actually, because they've not really understood what AI is about, it's easy for them to perception, and in the long run, we're not going to achieve the goals of that particular AI technology that we're bringing in with a goal of actually helping to solve health-related questions. So I think that's what I can say for now.
Thank you, Sylvia. And that's true. Public engagement is very important in this process. I'd just like to hear from Favor as well. How have you found that ethnicity and culture have impacted the development in your work? And what are you doing or have you seen being done to factor this into AI?
Thank you so much, Dr. Lisa. One, you know, when models are developed in the West and brought in here, we have issues of inclusivity, given our race, given our cultural norms, given our way of living. So even my past project of DTG-associated hyperglycemia, there was a deliberate integral part of GEI in this research, because having known the impact that AI has, if you do not follow GEI principles, it amplifies the status quo. And the status quo, I mean, for example, I'll say the men have a poor seeking health behavior when it comes to HIV. And so many women seek care. So when you look for the data sets of men, they are fewer. And there are also some fewer organizations that are looking after the children, because they are rapid progressors, there are those who are slow progressors, and all these things it's out of human control, but we should be mindful as we develop these things, because at the end of it all, it should be able to help human race, irrespective of the age disparity or segmentation, sex, where you come from, or what you do. So these are things that, as you're doing this very important piece of work, should be at the back of your mind, and we should be deliberate. How do they impact the population? For example, if I developed and I'd never cared about the children, and maybe one time a child comes and truly this is maybe the drug, DTGs, making the child develop hyperglycemia, and has been a treatment experienced child, you'll see that the services that have been intended to help the human race, it will only amplify the problem, that the children will not get the same services as the grown-ups. So if you're building to replace, for example, I've deployed it in a low research setting where services of HbA1c cannot be accessed to measure the glucose levels in your blood. So even this will deny the same services to the child. So what will be at stake will be life. At the end of it all, we are developing AI to make life, to make everybody, irrespective of their status in society, be able to get the same services. That should be the bottom line. Thank you.
Thank you, Nkeba. And I'd just also like to hear from Nneka, because I know you have experience trying to make sure that your products work for a large variety of people out in the market. So how would you answer this question?
Thank you. And just, I completely agree with, all that my colleagues have highlighted. For us, we co-design with the members that we serve. So at every step of the way, in designing our chatbot, so our chatbot is called CHEM, which in Igbo language is short for Nkem, which is my own, and Kemi, which comes from Yoruba language, which means cherish me or pamper me. And we were very intentional around even just, the name by which we call CHEM to underscore kind of the point that for us, this chatbot is really about supporting people in their own self-care and helping them build their agency and self-efficacy in terms of managing their own health. And so from the get-go, we've really kind of worked in the community, and we have what we call kind of iterative cycles of user testing, where we kind of learn from the communities that we serve. After it's initially been tested kind of with the ML team, working as part of a broader multidisciplinary team, our clinical team, which comprises different types of clinicians across Africa. So not just doctors, right? But nurses, fitness coaches, nutritionists, right? So a much broader spectrum of clinicians beyond just your doctor, so that, allied healthcare professionals, but then together with the members that we serve. So a diverse low-income population, reflective of kind of more the peri-urban and urban environments in Nigeria. And so very early on, we just have these kind of continuous cycles of testing. And I think what we've learned, and in a way, what's been concerning for us is, for instance, in terms of so right now, for instance, we're testing the integration of large language models with our existing bot, which was a CHEM, which was initially a rules-based bot, because we saw the power that large language models could potentially provide in terms of expanding our ability to answer the wide-ranging breadth and depth of inquiries that our members have. And I think it blew my mind personally in one of our first sets of user testing, where women would start just get excited actually by the amount of information that was provided and the answers that were being given. And in a number of cases, we saw women kind of go off to a corner and start writing, recognizing like, here is an opportunity for anonymity. which sometimes our healthcare workers do not provide, right? A lot of times, in our environments, we don't have the setups that really allow kind of privacy, and sometimes as health workers, we even reflect our own bias in our conversations with our patients. A lot of times, because we're working in overburdened healthcare systems, we don't have the time to be empathetic and to provide kind of empathetic, supportive guidance to the patients that we serve, right? And so now all of a sudden you have a bot that's like, how are you doing today? Tell me about what's going on. How are you feeling? So in a way that may not mimic that patient's experience in a typical public healthcare facility. And so what scared me, actually, to be frank, as a physician, was women being so excited by the depth and breadth of information being provided to them. And a lot of times this information was not realistic for their environment. So as Favor highlighted hemoglobin A1C, today, we serve thousands of members who have diabetes, and they can't afford a hemoglobin A1C test, right? And so when Chem integrated with an LLM is saying, oh, you need to make sure that you think about testing your hemoglobin A1C, when that's not feasible for them in their environments, and not considering even their economic capability from that perspective, or where they possibly could go, in many ways, I think it could defeat the purpose. So that's what we're trying to do a lot around training with our guidelines that exist, as well as training with our own data sets, right? So the thousands and thousands of existing data sets that represent the organic interactions between member and coaches in our own environment, that are evidence-based but contextualized. So we're hoping that helps to address some of these biases, and also reflects the culture and our social norms as a people. That said, I think it's important, I don't think this gets talked about enough. Though many of us physicians, nurses, etc., across Africa, were trained with guidelines from outside of Africa, right? We were trained with UK books and US books, medical books and nursing books. And so even, and many times we don't actually have existing guidelines or updated guidelines in terms of clinical medicine. And so this has been a big challenge for us around, as we're trying to address the cultural and diverse nuances of our own realities, integrate even local languages and dialects. How do you marry that when you've even been practicing medicine that's in many ways contextualized, but still based on guidelines that don't necessarily come from our own environment, which I think underscore, again, kind of this need for investment in research, in kind of revamping our educational systems, and these investments extend beyond just AI. And I'll stop there. Thank you.
Thank you. Thank you all for those very important insights. I think overall, I think it's important to just maintain that kind of consciousness of the power of the work that we are doing, and to also be open to continuous learning from others, but also through our work and as we get exposed to our communities, and also be open to iteration. I think that AI has a lot of iteration, and we must be cognizant of that. So I just want to ask one last question to our panelists, and for us to go through, just if you could give your answers quite briefly. What would you like to see done more in our context to support the research and uptake of responsible AI for health in Africa? And we'll start with Sylvia.
Great, thank you, Lisa. And for me, I feel the issue concerning sustainability is what stands out strongly for me, because one of the things in our countries that are low-income countries, one of the ways that we get opportunities to AI is through research, but we need to see how this AI that has been developed through research, how is it responding to the national national health systems and policies that structure, as well as the structures and the plan that they have for the health system. How do we kind of fit in these particular tools into the already existing national systems? So probably one of the things that I'll still emphasize on, that I talked about earlier, is public engagement, but still I would also like to emphasize something called the stakeholder engagement. How do we get to bring the government agencies into our work world that is coming from research, but then how do we get to engage these people, and how do we show them that actually AI is being very helpful? Because research, once the research projects come to an end, then what happens to the products, the amazing products that we have built? So for me, that is my take-home strong point. We need to do public engagement, stakeholder engagement, so that we can sustain our products from AI. Thank you.
Thank you, Sylvia. That's great. And I think it pushes, especially medical researchers, to think beyond just the end of the research and beyond the publication. Thank you. Rose, what would you like to see being done more?
Thank you very much for the question. And I've just seen a question that has been posted in the chat room by Ismail on Biden's the bill that Biden signed on the executive order around responsible AI, and I'm glad we are on a platform for responsible AI in Africa. So what I really want to see is that can we be able to develop artificial intelligence that promises safety for the patients that are going to use it, that is inclusive in nature, that does not amplify issues of bias. And I'm glad that we have representatives from the women in AI. I mean, can we be able to involve all stakeholders to have these conversations around artificial intelligence and responsible artificial intelligence in general? Can we be able to have a conversation on how we can collaboratively work on research projects that make artificial intelligence work for Africa? Because, of course, this should have been a bill that was protecting the American citizens. But where is that bill that is working for Africa to, amplify the uptake of responsible artificial intelligence in our healthy systems? If we have such conversations which are building around protecting the patient who is at the core of the use of this artificial intelligence, if we are going to collaborate on issues like the conversations we're having right now, to have medical practitioners, artificial intelligence experts in one room to understand the ecosystem of artificial intelligence and how we can be able to build ethical and reliable artificial intelligence solutions that are going to help our people, I believe that will be a very good initiative. But above all, the word should be, how can we collaboratively work as an ecosystem to build and embrace artificial intelligence that is working for Africa? Thank you.
Thank you, Rose. That's very profound. Nneka, what would you like to see being done more in our context?
Thank you. I completely agree with the notion of around collaboration. I think, adding on to that, I would say investing in education at all levels. We just can't wait. We can literally start, with the youngest of our children all the way up in terms of continuing education. We need to invest and create an AI literate population now. And we need to act with patient urgency. And we need to invest in amplifying the capability of our educational institutions to churn out the workforce that's needed, as Fiva highlighted earlier, that actually can leverage and be contributors to really building the AI landscape that we want to create across Africa. We can become a true powerhouse. This is our opportunity to compete at the global level, and we need to make those investments. And then the only second piece that I would just add is around data sets. Far too often when we talk about Africa, we say we don't have the data sets. And sure, fine. We do have the data sets. We just haven't essentially kind of codified the existing knowledge yet and packaged it so that it's actually high quality. And I just want to underscore this piece. Many of us have worked in hospitals across Africa where we leverage paper charts, longitudinal systems that do longitudinally capture the journey of a patient. That's a data set, right? What we need is kind of the investment cross-collaboratively in digitizing this and kind of a true investment in digitizing our healthcare systems so that more across the public and private sector can really take the opportunity in terms of leveraging the power that AI can bring, and so that we truly can transform the narrative for health across our continents.
Absolutely. Thank you, Nneka. And Favor, please.
Please. This is an interesting part. One, we have we are at the best point to begin this. That's what really the ray of hope I have, that because the infrastructure is new and Africa is at the preparation stage of digitization, we just need to be very, very systematic in how we do things. And this would help us to leapfrog ahead of the entire globe, because all the other continents have already digitized their systems. And AI of late is running on a whole different new infrastructure. And that is going to cost them. With this coming of the 5G, 5G is majorly a driver of AI, because systems must be fast, collect data fast, and the communication must be fast for us to realize what we want. Secondly, it's good that the scholars and researchers we've already started engaging to create a critical mass. To me, that's a beacon of hope. The red flag that I have is our lawmakers. They make blanket policies that kills innovation. But when you look at most developed nations, when they make these policies, they leave exclusions for startups to be nurtured. The Google giants should do more. The Facebooks should do more. They should be strict on already established giants in AI and technology, because they kill startups if they are given the same policies. And these policies that encourage innovations or startups should also be formulated, and we should go domain by domain, not saying one size fits all. What has worked in engineering, you borrow that and edit it and slap it in health without contextualizing the environment or the domain where we're working. This is very critical. That's why I always say that is killing, to me, is a red flag before even I can go to the data sets. Now, there's an issue of the data sets, and this is because there are no proper data policies on a national level at times, but even the accessibility to enable these researchers to go on, also it's becoming an issue. That's all I could say right now, leaving out the technological part and the willingness of our African governments to embrace and support, not in rhetoric, but also financially, stand. Because mainly the AI that is happening on the African continent is through grants, foreign funding, majorly. So we need our governments to know, or to also practically engage in these research activities and also implementation. Then we will realize this. Thank you so much.
Thank you, Favor. And I think you end on a very good note by saying that I think it's that you know, I agree very much with that I think our governments need to come and start to think more about what do the citizens need. I think everybody can say that. What do they need? And how can they get that? So we are over, but I see that there is one last question in the chat, which I think we can possibly take, and then we can be able to close. I'll ask people to bear with me. Hope to finish at 5 past. So the question is from Prof. Atli Gamundani. He says, Africa is data rich, but information poor. Oh, it's not a question, actually. I We have to start digitizing our archives and work from that data set. Enabling policies should be in place. Very much agreed, Properly. Thank you. All right, so there are no more questions in the chat or in the Q&A. But I believe that this has been a very, very enriching and informative webinar. I want to thank so much our panelists very much for coming, giving of your time and your knowledge and your experience. I want women at the table as giving us this opportunity to come to this webinar and discuss, bring people into the room and discuss matters that are important to us as Africans. Thank you very much.